What is advanced care planning? To me, advanced care planning is planning for the future, whether it's written on an official document, or whether it's written on a piece of paper, or whether it's just a conversation you have with the people who will be responsible for your care should you become unwell. It's actually having the time to actually think about what you want for your future care, where you want that future care to be, and how much care you actually really want.
Advanced care planning is really a conversation that people have between themselves and their family about what's important to them, how they live their life, maybe about what would happen if the time comes when they can't speak for themselves.
Advanced care planning is a process that we try to engage in with patients. They don't need to do it with their doctor, but for a lot of people it's easier to do it with their doctor because the doctor understands their illnesses and the natural history of those illnesses, what's going to happen as the illness progresses, what can be expected in the future.
It does, in a lot of respects, attempt to avoid any conflict that there may be later on in the future when the document is actually needed, so that the person responsible for your care is fully aware of your wishes. Even if you develop dementia, you no longer have the capacity to actually talk about what your wishes are. You have them written, you made them when you had the ability to do so. It actually stops conflict in families because they're aware that these were mom or dad's wishes. And it makes probably life a lot easier for everyone.
Most people do have ideas, and through life those ideas may change. So it's not a static process, advanced care planning. It may be a series of conversations over time as people realise what illnesses they develop, so it becomes clearer what problems they face.
While you can still make your decision, it will always be your decision about what care you want, but it's actually about the future when you can no longer make your decision known.
It might seem to some people a bit morbid, but on the other hand, I think it takes the pressure off the other family members when they sort of realise, well, this is what I really want. So when things do happen, they remember, well, the one way that we can honour the memory of this person is by actually making their wishes happen.
When is the right time to talk about advanced care planning?
I guess no time is too soon, really. At any point, it's really important to have these discussions with your family and your doctors as early as possible, because that's the whole point, is planning ahead.
Today is the right time to talk about advanced care planning. Any time is the right time to talk about advanced care planning. It can be similar to, you can think about other processes of planning for the future, such as writing a will. If it's a good time to write a will, which is talking about what happens to you after you die, what happens to your possessions after you die, then certainly at that time you can talk about what's going to happen when you get sick.
How comfortable are you talking about advanced care planning? I'm very comfortable talking about it. I've been doing it for quite some time now.
Most doctors think that patients don't want to talk about it, and that if they bring it up, it'll spoil their relationship with the patient, that patients go to doctors to be cured, and that doctors have a duty to inspire people to get better and to push them onwards and upwards and only give them good news. But we have a duty to talk to our patients about advanced care planning, and through doing it, it immediately became obvious that, from the first patient I started talking to about advanced care planning, it was immediately obvious that people want to talk about this.
Being nurses, we really care about our patients, and we're very comfortable talking to them about their disease processes, their family, their jobs, their home life. So this is just another part of being a nurse and providing, just really good holistic care.
I think as you get more comfortable, it's hard to start, but once you start talking about it, I think a lot of people tune in and think it's really important, so they naturally want to talk about it. So getting started is probably the hardest bit.
I suppose as a healthcare professional who works in palliative care, it's part of our daily routine almost. We have conversations with patients on a regular basis about their planning, their future, what's happening with their disease. It does really depend on the individual. Some conversations can be quite easy to have and flow quite easily, whereas others, and it does, I have to say, depend on some cultures. In some cultures it's taboo. You do not talk about death, the future. It's about cure and living.
Yeah, but it's interesting you said about the cultural aspect, because I've actually found, interpreting in my culture, this issue has come up, advanced care planning. And I have had reactions that ranged from, yeah, I'd love to talk about this. Yes, this is something that I have not been able to talk about, and this is a great opportunity actually to maybe bring this out in the open, to the response from the other end, where it's not so much taboo as more, I don't know, going into denial. I don't want to think about death and what will happen afterwards. I feel whatever God has planned for me is going to happen anyway, so why should I try and plan for it?
Yes.
And I, from what I've been talking with my colleagues as well, from other language groups, it's also a very similar thing. It might be the same culture, but it seems to be more a personal, maybe relationship with the topic of death and dying.
My way to craft that conversation would be, is with a fairly simple trigger question that would be, if the time came when you couldn't speak for yourself due to illness or injury, who would you want to speak on your behalf?
Well, I think it's just really building a rapport with the patient, asking them about, how they are. And then I think it's just not beating around the bush, but just going directly to the questions about, have they ever thought about who they would want to make decisions for them if they were unable to speak for themselves? And had they ever thought about, their future wishes and preferences for their healthcare if they became seriously ill in the future?
I find that most people have already thought about it, and you only need to just raise the topic and people will engage on advanced care planning. It's not, there's no magic password that you have to come up with. It's just a straightforward question.
Is there anything you avoid discussing with people who speak a language other than English? No. I think is a simple answer really from my point of view. Just because someone speaks another language doesn't mean you avoid certain topics. You might have to be a bit more sensitive regarding some topics, again because of culture, individuals, etc. But to me, no, I don't see any reason to avoid any topic at all.
No, as an interpreter, I just interpret whatever the health professional says. So, yes, it's not an issue.
We were very hesitant initially because of what we'd been told about the different cultures, because we have run 6 workshops across the area educating staff in advanced care planning, and the feedback from the different areas or the different hospitals from the staff was that, we've got a large cold population, we won't be doing advanced care planning with them. So Em and I were very hesitant about going forward with these conversations and visiting these patients in their home. And it's been actually quite the opposite. We've gone in quite tentatively and we've been welcomed into the home.
Absolutely.
The relatives have welcomed us, and we've had the conversations. We've completed advanced care plans with these patients and their families being present, and we've been overwhelmed with positive feedback from them. So I don't know where that information comes from and whether that it is evidence-based or whether it's just an anecdotal information that they've picked up during their workplaces. But from our point of view, we have had no barriers.
I'm a big believer that the individual have the best understanding about their own personal culture and what is applicable to them.
So for individuals, as a health professional, we should just touch base with them and say, how does this apply to you? Or I've heard about the war in country X. Were you affected by that? Would that be a reasonable way?
I think that is very respectful.
Oh.
I think that is extremely respectful, and again, it shows people that you are genuinely interested in them as a person. And again, if you ask them, look, you know, my apologies, I may not necessarily know a great deal about the country where you are from. However, I understand that there was a war, you know, or whatever it may be. But, you know, you also indicate that, no, you're not an expert, but you are interested. And I think people will very gladly let you know what it is that they think or what's applicable to them. We often hear health professionals say, oh, but we can't talk about death and dying in that cultural group. With some individuals, you can't within that group, yet with others, you can. We have elderly patients who get distressed thinking about the end of life, and then we have others who are thinking, okay, fine, I'm going to go out there, I'm going to spend all of my kids' inheritance.
Next question is, it's a good one. How can we make people feel more comfortable talking about advanced care planning? I think the way to make people feel comfortable about it is actually to just normalise it and just make it part of every day, of a Sunday lunch, of come and have dinner. There's something I want to talk to you about that's really important, that's been on my mind for a while.
I think just really reading people's body language, trying to maximise their comfort and minimise their anxieties, explaining things properly, and that openness and honesty, and really just empowering these patients makes them feel a lot more comfortable.
I think it is something you do have to build a rapport with people. You do have to gain their trust. Both the patient and the family have to get used to you. And it's also talking about it in a way of planning for the future, as opposed to, I think sometimes the term advanced care planning can be quite confronting, whereas planning for the future and planning for future care can actually make it a little bit easier and simpler to actually digest.
I think as well it's just really important we're both prepared that if it's unsuccessful, or if the patient or a family member isn't responding well to this, to know, let's just abort this conversation and perhaps delve a bit deeper into it another time.
Yes.
So it's about the patient's readiness, and some patients now is the right time to talk about it, and other patients, you know, we have had, you know, they've had a big trauma in the family and it's just not quite the appropriate time. So recognising that and listening to what they're telling us as well.
As an interpreter, what I like to see, or where I've seen these sorts of conversations become very successful, are within a clinical setting when people haven't been rushed, when there's enough time given, because I think a lot of times people don't really understand some of the ideas or concepts that we bring out. So where they have that ability to digest the information, where they see that the health professional is being genuine.
I think the people really we have to make more comfortable talking about advanced care planning are healthcare professionals. I think the patients and their families are ready. They're dying to talk, well, not dying to talk about it, but they're really ready to talk about it.
I just think it's really something that you can help to empower your patients. So that's why I really enjoy talking to them about this, because it's giving them control, and sort of the decision making comes back to them. Healthcare professionals are not trained so much to give bad news, and they're more used to portraying a positive spin. You know, we can do something for your condition. We can give you this treatment. We can give you chemotherapy. We can do surgery. But they're not so good at saying, well, this chemotherapy will give you an extra, on average, 5 weeks of life, but you're going to be sick for 6 months while you get that. You know, do you want to be sick for 6 months and live an extra 5 weeks, or would you rather go on a cruise for 3 months and then come back and be sick at the end of that time? I think people should have those choices. We should offer people those choices and not relentlessly push them to have more treatment
And I think most doctors realise that. Certainly for themselves, surveys show that doctors have less treatment than they prescribe for patients. And if the treatment is only marginally effective, we need to communicate that to them and let them make their own choices, because for most people, making their own choices about life is what's most important.
Have you done your own advanced care plan? Yes.
No.
Have I done my own advanced care planning? I've had conversations about it. I haven't written a document, but I have had conversations with my family about what treatment I want.
Have you done your own advanced care plan?
I haven't yet. I'm 32 years old, so I'm thinking about the future and planning ahead, but I'm hoping I won't actually need to make one for many years yet.
Have you done your own advanced care plan? No. And maybe I need to think about doing that.
I haven't done a formal advanced care plan, but I have actually talked with my family.
I haven't done an advanced care plan, but I've been very open with the conversation with my 2 daughters and my husband about what I'd want in the future and what I would find unbearable in the future. And I will be writing my healthcare wishes down shortly.
Good to talk about it and keep
Oh,
talking
yeah.
about it.
I'll go home, have a glass of wine and start the conversation.
Make a day.